you had mentioned it's a great way, actually, the way you framed it, right? Data is incredibly important here, right? You mentioned that in order to see the entire elephant, you have to see the entire elephant, not just like someone sees the trunk, someone sees the big leg, someone sees the body, and then you think it's different things, right? Now, a lot of folks would probably maybe incorrectly assume that, oh, like we're a central single payer system that doesn't like, don't we see all this already? Like, why is this even a problem, right? So clearly it is a problem. And in recent times, well, not recent, maybe last decade or so, maybe a little bit more so than that, especially now with the push of AI, right? There's this concern around data privacy, right? Especially
Mm-hmm.
data privacy is a big concern, right? So now it's like, oh, now me as a patient, going to give like some group this all encompassing power over all my data, that they see everything. And you know it depends on what side you're on, right? Oh, the government has all this data. That's like, now they know everything about me. I don't want that, right? So yeah, how do you think about those growing concerns in this world? Because this only works, as you suggested, with if there's no data that's
Yeah.
combined or integrated, then there is no this system cannot
Yeah.
exist.
So thanks for that question, because actually, I've been involved in many pushes with other patient advocacy groups in the Pan Canadian Health Data Strategy and in the Quebec Health Data Law. And one of the main things that we were advocating for is stop assuming that patients don't want to share their data and talk to them. And when we spoke to them, they said, explain to me how you will use my data, explain to me how you will secure my data, and I will be happy to share it. And if it's going to help me and or others, I'll be happy to do it. And one of the things that the Quebec health data law included, which I think is really key to making sure that patients are reassured, is that there's a now I'm thinking in French, but there's a logging of access. So there's actually everybody who has consulted your file, you have access to seeing, my pharmacist, my um, doctor, my family doctor, my nurse. You have their names and when they consulted which part of your file of your health record. That exists already now, and so it gives accountability. There's very serious fines for breaking that. You can report someone. Let's say my neighbor is a pharmacist, but she's not my pharmacist and she's consulting my record. I can actually, you know tell on her and make her get in trouble, and there's huge fines, there's big consequences. So I think we just need to not paternalize patients and assume that they're going to be so scared to share their data, but actually, how much we share our data with social media and all these things. I think we need to just tell them that it'll help us to treat them better, because today we're driving the airplane blind. We have no data and we're making potentially really poor decisions based on assumptions and not based on data. So I think it's a step up to actually collect that data, allow it to follow the patient. I mean, I was shocked to learn that pharmacists will give you a prescription without knowing what your diagnosis is, because they don't have access to your diagnosis. So then they have to play a game of charades to guess, are you taking Revlimid for arthritis or for multiple myeloma? This is crazy. Like, they should know. I want them to know. I want my pharmacist to understand what my diagnosis is, so that they can make better decisions and advise me on potential, interactions with other drugs. And so today we're flying the airplane blind. I want all of the pilots to have all of the information that they need. So they need proper dashboards. They need to see my whole health record if that's what they need to make a better decision. But we need to collect it, and we need to collect it in a way that's good quality data that gives us confidence to make better decisions, not just for governments and HTA and reimbursement decisions, but also for my clinical care. I want everybody who deals with me to have all the information that they need, and I want them to share it with me, so that me and my family can also make the best decisions for us with the right information. That's not based on population level information, but it's based on me living in East End Montreal, you know uh, where I'm working from home most of the time, and I have certain hobbies that I want to maintain. And will I be able to continue doing that? Will I be able to continue working? Like, I need data to make those decisions. And today we're just assuming based on literature, based on very well-intentioned healthcare professionals. But I think that we need to start really empowering patients and families to make decisions as well. And the most equitable way to do that is to just ask everyone, collect it in a standardized way, be able to analyze it on like a unified kind of centralized platform that allows people to make better decisions, and not having disparate fragmented data silos everywhere. And that's where we're starting. So we need to actually find a way to use tools to go and extrapolate that data so that it makes sense and it helps us to make better value-based decisions.